Dr. Kyle Naylor here. Today we're going to go over an ACL tear, the tests, signs and symptoms, and of course some recovery tips. Now, we know Andrew McCutcheon for the Phillies is out for the season with an ACL tear.
Bummer. This is a bummer, man. That's a bummer.
And I want to educate you guys, let you know, and hopefully, you guys can see whether or not you may have one. But again, if you think you have an ACL issue, go see a movement provider and get it taken care of. Now, the mechanism for an ACL tear is going to be planting that foot. It's a non-contact injury, meaning that nobody's really getting hit. It can occur without impact.
Oh my God! Wow!
Now, this injury itself, you will be planting, the body's momentum will be moving forward, and that ACL can go. Now, you can also have rotation with it as well, and so we think about sometimes football players planting with the cleats in the turf, and then they're trying to juke and they move. Now, when you have a rotational component, that can cause injury to other anatomical structures such as your medial meniscus and your MCL, which is your medial collateral ligament. Now, the signs and symptoms for an immediate ACL tear are going to be instability, so you'll have the feeling like you can't plant your foot, that there's no strength there. You'll have swelling. You'll also have muscle spasms. Now, with the swelling and the muscle spasms, you may get a false negative with the test that you do with the leg if you do it immediately after. What that means is that it's a false, meaning that it's not true, negative test, meaning that the test will come out negative and it won't show an ACL tear because the muscle spasms and the swelling will actually hold back that knee from any movement in that acute phase. So the two tests we're looking at for the ACL tear here are going to be Lachman's test, which will sit at the 45-degree angle. I'll grab his femur and his tibia. I'm going to take his femur, push it down as I pull this tibia forward and up. And so we should see that tibia slide forward and the femur slide back if it's a positive ACL tear. Again, check both legs so that way you find a discrepancy and you can compare from the good leg to the bad leg. And then you'll do an anterior drawer test, which is going to be putting the foot, knees bent at 90 degrees. I'm going to take my butt, sit on his foot to lock it down, interlock my fingers behind his tibia, and then just slide his tibia forward. And I'm going to kind of pull pretty forcefully here. And again, if that tibia slides forward, we're looking at an ACL tear. Make sure though that they don't already have a PCL tear in there either, because with a PCL tear, the tibia is going to drop backwards, and then therefore when you do this test, it can mimic an ACL tear. Now, for recovery purposes, you want to make sure, it depends on what type of care, right? If you're going surgical or if you're going conservative care meaning no surgery. Now, and that would be physical therapy, things like that. Now, if you're going conservative care, there are studies that show surgery compared to conservative care. The conservative care group, they never actually got back to 100% of their activity level.
This is a bummer, man.
Now, it doesn't say whether or not, it's not that they couldn't, it's mainly that they wouldn't. And more of a subjective mindset, right? They wouldn't go back to playing as hard as they did prior. Now, in the study, it's not clear whether or not that's because maybe the practitioner was biased and told them not to, or if it was psychologically in their mindset, they just didn't think they were healed 100%. For surgery, for pre-op or post-op, we know before surgery it's always good to work on quad strength and terminal knee extension, because those two things are likely to not return to 100% after surgery, so you need to make sure that you work on them prior. And then post-surgical treatment is going to be working on that posterior chain being the hamstring strength and those glutes. So the glutes, of course, all of that turns into neuromuscular control, which evidence shows the biggest modifiable risk factor for an ACL tear is going to be neuromuscular control. What that means, the most modifiable, is that we have control over it. We can practice it and put effort into it to make sure that we avoid any ACL injuries. That neuromuscular portion is that mind-muscle portion, mind-muscle connection, making sure that we work on the glutes to disperse the force and we work on the stability aspect of it. So that way when we plant, everything doesn't go into our knee joint onto our ACL. When we're planting and we're moving, we're making sure we have proprioception, correct activation of the muscles, and correct stability as well. So I hope this helps as far as the ACL tear goes. I hope you don't have one, and if you do, just remember you can get back to playing 100%. I mean, take a look at Adrian Peterson. But I hope you enjoyed this video. Give a thumbs up if you enjoyed it. Comment below if you know somebody that has gone through this, and even tag them in it. And then of course, enjoy your day. Peace.